Everyone, we'll just give it a couple of minutes to allow everyone to jump in before we get kick-started. Everyone can see participants popping in. We're just going to give it a couple of minutes before we start, just to make sure everyone's had time to join. I'll just give it one more minute, I think, Declan and Hannah, so I can see everyone's still jumping in, and then we'll go. Great. I think we're probably good to kick off. So first off, welcome everybody to the first session of our healthcare webinar series. Great to be joined by so many NHS trusts and health board today, alongside some of our key partners as well. So firstly, thank you all for your time. Now, this three-part series is taking part throughout May, and we're going to be specifically focusing on UK healthcare customers across England and Wales and some of the unique challenges that you face, including data security, complex regulations, NHS guidance, integration of legacy systems, and supporting critical infrastructure across the network, such as electronic patient records. Over the three-part series, we've got expert speakers who are going to guide you through some strategies to build secure foundations of policy and segmentation across the network. And we hope you'll take away some guidance and insights to improve your infrastructure maturity and patient care outcomes wherever you are today on that journey. Now, today's session is going to focus on our infrastructure leaders' healthcare priorities and our view of that evolving landscape. There'll be plenty of time at the end for Q&A, so please, if you've got any questions as we go, pop those within the Q&A tab. Would ask you to use that rather than the chat section. I know Stephen's already posted asking that, so it should be in the three buttons at the bottom within your WebEx application. So please fire in questions as we go. We'll answer them in the chat, but can also circle back and discuss at the end of today's session. But we also hope you'll join us for sessions 2 and 3, where we're effectively going to dive deeper into the topics. So session 2, as you see, is going to focus around policy best practices. We're going to talk around how to approach segmentation and maximise existing investments, and plenty of guidance and demonstrations within that. And then finally, session 3 towards the end of the month on the 22nd of May will be around automating policy to deliver segmentation at scale, again, featuring plenty of demos within that content. So throughout, we'll be sharing resources on how Cisco can support you on this journey, again, whether you're at the start or more advanced stages of this. For those future sessions, feel free to use the QR code there, and perhaps James, if you can post the registration link as well in the chat, so everyone can register here and now for sessions 2 and 3. Just a few bits of housekeeping before I hand over to Hannah and Declan. Please stay on mute, but we encourage, as said, all questions within the Q&A as we go. And you should get feedback form after today's session. Please do fill that out, help us inform the future sessions and future content that we put together for all of you here today. So jump over to the next slide, please, and let's get started with session 1. And today we're going to be joined by our cybersecurity specialist across healthcare, Hannah Mills, and our Cisco healthcare lead and former NHS CIO, Declan Hadley. So I will hand over to you both.
Perfect. Thank you, Lara. So I'm going to take the first 10 minutes of the session just to set the scene a little bit, as when we talk about securing the next generation healthcare environment, at its heart, it's really about protecting trusts against cyber attacks, which could compromise medical records, disrupt critical medical equipment, or even delay life-saving treatment. Now, cybercrime is a global threat. This isn't something that is unique to the NHS. But what is unique to the NHS is the complexity, the scale, the presence of legacy technology that is notoriously harder to protect. The amount of sensitive patient data, the amount of things that are connected into a healthcare environment, from devices through to IV pumps, the medical research that you guys are undertaking, this combination makes the NHS a really attractive target to cyber criminals. These incidents will disrupt critical services. This is just a very high-level snapshot about what we've seen in the press across the last 18 months. And this just highlights that we need to enhance cybersecurity measures across the NHS. This isn't all doom and gloom, though. There are some real positives to actually be taken out of the current situation. So the fact that UK government and NCSE have been very firm in their stance that we should not be paying ransoms to cyber criminals, that in combination with cyber now being a board level imperative, hopefully that should mean that we should start seeing some additional funding being opened up. So those two things demonstrate that we are making progress. Now, some research might even suggest that incidents have plateaued, but that absolutely doesn't mean that we can take our eye off of this. So if we move on, please, Declan. So if we look back over the last few decades, threat actors look drastically different. And in many cases, only state-sponsored actors were a major concern many years ago, but times have changed. Criminal groups are making hundreds of thousands of millions of dollars from ransomware campaigns. These tend to be the most common attacks that we see in NHS. These groups are using recently, and in some cases, zero-day, previously unexploited vulnerabilities to gain access to your infrastructure. We've seen cyber criminals launching supply chain attacks, which until very recently was strictly an area reserved for nation states alone. They're also finding other ways of monetizing attacks. For example, you can buy a ransomware as a service attack on the dark web now for as little as $19. That feeds into new categories of cyber threat coming from thrill seekers, from insiders. And each of those threats and motivations presents its own unique challenges in detection and prevention. And unfortunately, you've got to be prepared to protect your trust against all of these, not just maybe one or two. Every organisation is a potential victim. Every NHS trust is a potential victim. Everyone has something of value that is worth something to somebody else. Now, historically, cyber is often pigeonholed as an IT issue. Let's be clear, it isn't an IT issue. It's a whole organisation issue. Whilst IT will provide the technology to defend the trust, it is only as good as the policy, the process, and the people all working together towards that common goal. Now, there isn't a single silver bullet. I would love to sit here and tell you that there was, but it's a combination of elements. Start with the basics. Good cyber hygiene practices aligned with your policy and process, that's absolutely the foundation to build from. As part of your risk management processes, and this is an IT, you should be continually assessing whether you are likely to be a victim of a targeted or an untargeted attack. Every trust, every organization that is connected to the internet should assume they will be a victim. Now, some of those basic cyber hygiene principles are things like having an automated backup policy, having an automated backup. Do you have immutable copies of your data? Having an MFA policy. Are you hardening your hardware and software? Do you have a strong password policy, patch management and vulnerability processes in place? And actually, do you have really good user education and training? Because to do the basics well, and this is the foundation that you have to build on, some of those elements that I've just run through, yes, they are technology focused, but as with most other security standards out there, whether it be a NIST, whether it be a NIST 2, a Cyber Essentials, these are all about bringing together people, process, and technology. Technology alone will not protect you against an attack. All of these elements have to be aligned to ensure that you can lessen any impact on the delivery of patient care. Once you've got those foundations in place, that makes adhering to things like the new cyber assessment framework guidance a much easier transition. So next slide, please, Declan. So we do appreciate there's been a significant shift in the ask of the NHS when it was announced last year that you'll need to transition from DSTP to CAF. This new approach will fundamentally affect the way that you're evaluated and the way that you're assured across cybersecurity and information governance. It's a significant shift away from the 140 different assertions across the 10 data security standards you've been used to when you've been used to self-assessing as part of DSTP. I really like the fact that this new approach is outcome focused. It gives trusts the flexibility to tailor their cyber and governance processes to their own unique circumstances. So I think it is a lot less prescriptive than what DSTP was. The other area that I think is great for CAF is that there's an element here about lessons learned. So this really enables us to take learnings from incidents, from near misses, allows us to implement those lessons to improve the resiliency of our essential functions. Many controls that we see in industry are perceived very much as a one and done, but by having this regular process embedded on what is being assessed on a regular basis means that practices are going to be continuously updated in line with the changing requirements and the changing threat landscapes. So if we look at a specific example aligned to the topic area today around securing next generation healthcare, in its rawest form, this is about segmentation, specifically objective B4, which is around system security, and B5, which is the resilient network and systems. They both talk about segmentation and segregation of systems. Now, if we look at the NHSE guidance on segmentation and medical device segmentation, they list out 7 different ways you can approach this. DMZs, VLANs, ACLs, application segmentation, zero trust, microsegmentation, and software defined. So unlike something like a Cyber Essentials, and you have to forgive me, I'm not sure if IASME have updated their requirements, but they used to stipulate if you wanted to do segmentation, you had to use a hardware firewall and a VLAN. And in the world that we are moving towards, which is more software defined, that's notoriously difficult to do. Using an outcome-based approach like CAF gives the trust the ability to achieve that objective in the most appropriate way for the individual trust. It could be a DMZ, it could be zero trust. It doesn't matter. What matters is you are applying the most appropriate level of security control that is right for your environment. By using this approach, we fundamentally move away from this being a tick box exercise, which unfortunately is it's kind of undermined some of the cyber standards in the past, which are fundamentally there to protect your environment. So last slide, please, Declan. So We have sadly seen the first death that was attributed to a cyber incident. This happened in Dusseldorf in 2020, where sadly a patient died in the back of an ambulance as they were not able to be admitted to their local hospital, and they passed away in transit to the next nearest hospital, which was over 30 kilometres away. Now, I don't believe we've seen anything on that scale in the UK, but actually, interestingly, Mike Fell, who's the executive director for security operations at NHSE, shared some data following the Synovus incident last year. 10,000 patient appointments deferred, 1,700 elected cases deferred, 5 cases of moderate harm from that supply chain incident. I think sometimes we just need to remind ourselves that there's a real human impact to cyber incidents, and that's what we're here to trying to prevent. So Declan, with that, I'm going to hand across to you.
Thank you, Hannah. And just to expand a little bit on my introduction, for those people who know me, they'll know that prior to joining Cisco around 4 years ago, I've worked in the NHS for over 30 years. And during that time, one of my kind of things that really come back to over and over again was the impact of WannaCry in the region where I was working. It's certainly a month or two of my life that I'm never going to get back. And it really opened my eyes to the impact of a cyber attack and the impact that causes on operational services. I was, in preparation for this webinar, I talked to one of my former colleagues who works in the cybersecurity space. And we talked about a number of things, and he said a number of things to me that actually made me think about what kind of approach we can take to improve general cybersecurity. How within this webinar series we can give you some insights, some strategies that will hopefully improve your ability as cyber specialists, if that's what you're doing, to improve your engagement, your connectivity to the wider organisation. And as you've already heard from Hannah, most of what we talk about in terms of preventing cyber attack, preventing data loss, is generally a whole systems approach. With WannaCry, anybody who was involved in that will have seen that was, in terms of an attack perspective, an attack on Microsoft Windows machines, Windows-based devices, which was fine, but the consequences of that went way, way beyond the desktop. And certainly in my experience, it wasn't so much the machines that were infected. The impact was caused by the things that weren't infected. The consequences of people potentially panicking, maybe taking steps to prevent further infections. It was the loss of connectivity across the system that caused the biggest amount of impact on clinical and other operations. Even those organisations in the system where I was working that weren't infected, had taken steps around patching, were impacted because of the wider system impact. And when we look at cybersecurity and all of the steps that you can take, it's not just, in some respects, it's not just about the organisation you work in, it's those organisations that are working around you. So even though that was specifically targeted, it had huge impact, day one impact, but also for probably many months after that particular event. And coming into Cisco, I've learned an awful lot about actions and steps that potentially, some of which were available and some which are definitely available now, that you could take to prevent that wider impact, that wider set of consequences from an attack. I think most people in the cyberspace would say a cyber attack is inevitable at some point. It's happening day in and day out. But the likelihood of a future WannaCry, particularly with all of the international tensions at the moment, the likelihood and the impact of that is ever increasing. What we also see, if we go back, 2017 and compare it to today, the landscape is evolving quite dramatically, particularly in this area of IT and OT convergence, something that I'm doing quite a lot, and other colleagues in Cisco are doing an awful lot with organizations where they're kind of blending together their traditional kind of estates technologies stack and their IT technology stack. And we're seeing a proliferation of sensors, devices, technologies being implemented on a common network platform, which I think is a very good thing. But actually, in the event of the worst happening in terms of an attack and bad actors taking control of those devices, the impact could be quite significant. Well, could do more harm than it would have done back in 2017. And this is only going to continue. This trajectory is only going to continue to expand and evolve. Anybody involved in the new hospital program, anybody with a major refurb will see these kind of things happening. Asset tracking, technologies that enable patient safety, not just the equipment that's connected to a patient in ICU or in other clinical environments. So the approaches that you've got to take going forward need to take account of this changing landscape. The engagements that the people on the call, who are cyber experts on the call, they're going to have to adapt and change their role, their techniques to address this ever-changing and expanding threat landscape. To that end, based on the conversations I've had with colleagues and learning taking into account what I've learned inside Cisco, I've tried to set out some broad themes. And these aren't really technical things, because you'll get that from the ongoing webinars. The 2 webinars that follow this talk about some of the policy-based approaches that you can take. And we often talk to people about, or people tell me, Declan, do I want everything in, one particular flavor of vendor and provider of solutions, or do I want, or do I want a mixed environment? And I think that's not the question. The question is, have you got a consistent policy approach across all of your infrastructure, your technology stack, and also a policy approach for the wider organization, rather than having flavor A, flavor B of solutions? Actually, it's the policy approach that matters. And I think you'll get a sense of that. And also how you can design in security into the underpinning architecture. But for now, if we focus on some of the things I drew out from the conversation I had a couple of weeks ago, cybersecurity, and we talk about this, and I used to talk about this in my old organization, but I have definitely changed my opinion and approach to this. It really is about this board-to-ward approach for cybersecurity. Cybersecurity shouldn't just be confined to mandatory training. It should be something that's top of mind for all clinical and operational people. And it should be top of mind because in the event of an attack, in the event that a bad actor gets in, the potential for harm is significantly increased from what it was 5-10 years ago. And that's why it's important. Any of colleagues out there now who are facing kind of conversations with operational people saying, you can't get onto that machine to upgrade it or do whatever you need to do, you need to be pushing back and saying that machine, that desktop, is just as critical to patient care, potentially, as the device that's connected to the heart monitor or anything else. So this conversation, or the conversations that need to be happening in an organisation, do really need to start both at the top and the bottom. The ward staff, everybody needs to be aware of what the consequences, what the sort of basic things that Hannah talked about need to be done and why they should be done. There's an awful lot of things that are going to be done or need to be done in the coming future around culture and training, particularly as cyber or bad actors start to use social engineering and techniques, because something on the radio yesterday about, I think it was around Marks and Spencer's, because potentially they've got the prerequisite technology in place, that actually it might be social engineering that gets them into the organization. So the way threat actors are actually penetrating organizations is changing and will constantly change, particularly with the proliferation of AI tools and techniques, deepfakes and all those kind of things. So culture, policy and awareness are absolutely critical in terms of your holistic strategy for cybersecurity. And then on the other side of this is about the design and operation. The 2 webinars that follow are absolutely going to be giving you the tools, the techniques, the fundamental basics around the network architecture to ensure that you've designed in security. I'm a massive advocate now. If you'd have asked me 5, 6 years ago, I probably wouldn't have been able to articulate the value of a cross-architectural approach. Now it's almost evangelizing about this concept of cross-architecture. What we need to be looking at is how individuals within or how the technology stacks interact with each other. How do we ensure security is persistent and consistent in terms of policy across those different technology stacks? And also this thing around how we integrate this wider strategy we talked about observing and responding. Observing things that are happening, reporting things in, using various committee structures, and I'll go on and explain a little bit more about that. So this isn't meant to be an exhaustive list. There are many other elements that you could take on board, but I've just tried to encapsulate this model around policy, culture, design, and observability. If you're not already adopting a kind of near miss or never event type culture around cyber, then I absolutely would advocate that now. Learning, accepting that people are going to make mistakes. It's inevitable. People are going to be tired. Clinical operational people will be tired. They've been working a long shift. There's some very creative people out there who are going to socially engineer situations. But actually what you should be doing is really understanding where people have made a mistake, not to attribute blame, but to understand what happened and why it happened and learn from that. The cyber agenda, and anybody who's I think it's better than it probably was, but still a long way to go. Anybody who's been working with boards, senior management teams, needs to make sure that those board management teams are fully aware of the consequences and actually, as Hannah suggested, are investing not just in the technology, but the people who manage those technologies. It's just as important around their leadership abilities to be able to get out there and start to evangelize, raise awareness of potential threats. I won't go and reiterate all the basic hygiene things that Hannah talked about, possibly 1, 2-factor authentication, because I think that, anything that mitigates that kind of social engineering approach should be absolutely followed. As in my old role, and even now, I still feel that the basic strategy for every organisation, for every healthcare system, and I don't just mean the individual organisations, should be around better systems or less systems, better integrated. The less you've got to worry about, the more time you can spend on those systems. And I know that's a huge challenge for most healthcare organisations, particularly acute trusts out there, where they've got lots and lots and lots of legacy systems. You just can't switch them off. But you actively should be pursuing a strategy, not just tied into your EPR, but more broadly around consolidation, because I think that presents less threat vectors and allows you more time to concentrate on the systems and solutions that you've got in place. When I was talking to one of my old colleagues, he was saying about how, do his other colleagues listen? And I think if they're not, they should be. And again, hopefully many of you in the audience are already doing this. You really need to be thinking about security is not just the domain, the responsibility of the security individual or security team, if you're really lucky. It should be the network engineer, the data center guy, the communications person. All of that team needs to be taking a cohesive approach to security. And again, in the 2 webinars that follow, you will see some techniques and things that absolutely might be the networking team that are implementing them, but the security person needs to be absolutely involved and engaged in that, and there needs to be a consistent dialogue. And that is a role for, again, if I went back and did some of the things I've done previously, I really would put time and energy into the leadership, team development of those infrastructure experts. Security by design, macro segmentation. I cannot stress enough how important that is in terms of an overarching holistic security approach to you. And this is why we put these webinars on, the 2 following ones particularly, where we're going to really kind of help you get to grips with that. And it's not easy. It has its challenges, but actually at the end of this webinar series, we want you to be fully confident and able to reach out, ask for additional support and advice, because it's probably, you think about WannaCry, it's probably one of the best ways you can limit the blast of that inevitable cyber attack. Absolutely should be using your committee structures. If you're not already reporting into the audit committee, you should be. I would probably say that as security specialists, or if you've got security in your portfolio, if you're not being in the board once a year, then that's an absolute loss of that organisation. You need to be on a regular cycle of engagement. And it's not just reporting that everything's happy or there's a big risk issue. It's about having an active conversation with those with the leadership within your organisation. Resilience, and we talk a lot about resilience, isn't just about the electronic patient record. In my experience, and as I said, that experience has made a big impact on my kind of attitude to cybersecurity and security in general. When we come to WannaCry, those people who are in the system that I was in, the thing that really, really struck with me was the day one consequences of cyber. And yes, there were lots of consequences from people unplugging things and things like that, but it was the car parking barriers that really, really kind of resonated with me. Who'd have thought that the cyber attack, the WannaCry thing, would impact so much in terms of the car park? And the car park was impacted because people couldn't go home, they couldn't come into hospital, visitors couldn't come in, they couldn't go in and out of that hospital. And whilst I think we can probably manage the car parking barriers going forward, it really does make you think about this wider IT and OT convergence agenda and the consequences now in terms of threat vectors and the impact of bad actors in there. Utilities, water, power, turning the air conditioning off or turning it back on, those and being able to influence that, making a ward environment too hot can have life-changing consequences, as in being too cold. So really, really think beyond your core systems, and if ever you want any kind of example for the board or senior leadership, car parking barriers is a great one. Car parking, as anybody who works in the NHS knows, is a hot topic all of the time. So just kind of finally, kind of wrapping this up a little bit here now, effective security is a layered approach, and rainbows there for one, two of my old colleagues, just as a reference to this idea about a rainbow approach. The most important thing is around people. How do we make sure that cybersecurity and security in general is a care about for everybody in the organisation, from the board to the ward? Do we know that our data and the data that's in there, my data, your data, everybody's data, health data, is an incredibly valuable asset? And it's got so much personal information. Increasingly, when we start to bring in things like genomics, it can have lifelong consequences for breaches of those data. And we need to make sure that not only have we got it backed up, because quite often you might have secured it and somebody's come in and encrypted it. If they've not stolen it, if you still can't access it, that's going to have consequences. So a strategy around your data is probably the next thing I'd put in there. And then we come down to this. But if you think about the network and what you're going to see in the remaining two webinars, you will get a strategy that, let's build it up from the bottom. Let's make sure that in the event of the worst things happening, we've got a design that limits the impact. But ultimately, when it does happen, and it will, and I really, really wish I'd known about something called Talos. Now, we're not particularly going to pitch this particularly today, but we are not pitching products per se, but I really wanted to make people aware of what Talos is. And it's there for you in your moment of need. And believe me, if there was a number I could have run 7, 8 years ago, I would have been so pleased to have somebody to give me advice. So Hannah, would you be willing to just give us a little bit of an overview of Talos, just for colleagues on the call?
Yeah, absolutely. So Talos are Cisco's threat intelligence organisation. They are a team of over 500 individuals. Talos actually came to Cisco in 2013 when Cisco acquired Sourcefire. And it's probably our best kept secret. This was the pivotal turning point where I think Cisco really transitioned from just a networking company to a networking and security based organization, because it's the intelligence that Talos brought with them. There's only two ways to actually get access to Talos. So the first one is through Cisco Security Solutions, because everything that Talos do, all of the threat intelligence that they see, they turn into actionable insights that is actually fed into our security technology. So that's one way to get access to Talos, is you get all of that threat intelligence when you support Cisco Security and you purchase Cisco Security. Now, the other way is through an incident response retainer. So as Declan said, you know, you're having the worst day of your career, you're impacted by an incident. The incident response retainer allows you to pick up the phone, have a Talos engineer stand shoulder to shoulder with you whilst you remediate any threats, remediate the attack, work out what's happened in your environment. The really nice thing about the Talos incident response retainer with those reactive and proactive services is you also have the ability to ask Talos to come in a preventative way to stress test your cyber incident response plans, do tabletop exercises, do red team, purple team exercises to stress test your scenario before you have that worst day. So it's a really nice service that is available to our customers. I think a lot of our customers are actually looking at this as a little bit of a safety net. And I don't think it's something that we talk about often enough in terms of the capability that we have there, which is open and accessible to everybody.
Thank you, Hannah. And again, I would I know we've got, and those of you working in the front line in the NHS now will have services, central bodies you can go to and everything else. And those existed to some degree when I was kind of on Gold Command during the WannaCry. Having this ability to reach out to a friend, a really knowledgeable friend, and take their advice would have been absolutely worth its weight in gold. So that's, we're saying we're not really pitching products here, but this particular type of service is an absolute no-brainer for anybody in an emergency situation. So we're going to just move on now a little bit into some questions. Before we go questions to the audience, I've just got a few things I'd just like to talk through with Hannah and get her experience, her expertise into this, and give you a chance as an audience to ask us questions. And we've got other experts on the call here. So we've got an absolute raft of experts on this call ready to take any questions from the audience. But before we get going, Hannah, just while our audience are thinking through those questions, if you were working in an NHS organisation in a security role, for example, what would your priorities be?
So to absolutely go back to do the basics well, make sure that you have those basic cyber hygiene principles in place across all of those areas that obviously I spoke about earlier. But the ones where are going to offer you greatest levels of protection are things like segmentation, least privilege access, zero trust, whatever you want to call it, because we need to reduce that blast service. And I'm not just talking about segmentation from a network perspective. I'm talking about take that segmentation type capability and pop it in your data center, pop it in your cloud. Make sure the applications that shouldn't be talking to each other do not talk to each other. So taking it and extending that right across your infrastructure, that would be the most significant way that you can reduce that blast service and that blast radius. And then from a least privilege access perspective, only give people access to things that they fundamentally need to do their job. Make sure you are doing housekeeping on those elevated privilege levels that obviously some people have within their organization. A lot of people call it zero trust principles. Some people call it least privilege access. Call it what you want. Just give people access to the tools that they need to do their jobs and nothing else. Because when you then start getting into things like identity, social engineering, again, that reduces the kind of the radius for any threat.
It's interesting you say that, Hannah. When I first started in Cisco, I think my boss asked me about the security. So Cisco adopts a fairly rigorous zero trust approach, and he was, what do you think, Declan? Well, I'm kind of incredibly frustrated that I keep having to authenticate and validate. And to be honest, the solution's got a little bit better in terms of managing that for the time, even in the 4 years that I've been here. And I thought to myself, well, this is not going to work. I feel very, very differently now, Hannah. Whether I've been kind of, assimilated into that mindset, I don't know. But I am absolutely adamant now that kind of constant challenge, that approach to only get access to what you need to. And after a while, and I can hear people almost in the audience going, I've tried this, and the staff kick off and all that kind of thing. Well, come back to that principle. This is about patient safety. This is about protecting our staff, protecting our patients, protecting the organisation, protecting the NHS. So if you have to click a few extra times, then so be it, because actually the consequences could be quite dire if we don't. So it's surprising how quickly, though, that kind of approach around having to validate and authenticate, it becomes muscle memory. You start to ignore it after. Well, you don't ignore it because you have to do it, but it doesn't become the problem it did on day one. And I would just, help organisations, help the experts out there really kind of just persist and keep pushing those kind of things. If you were in the NHS, Hannah, and there was a breach, what steps would you take? What would be your priorities? What would you prioritise?
So and it's a really difficult one to answer because every organisation is different. What I would be doing before you even get to the point of you are breached, I would be stress testing my plan. Absolutely testing it hard, going through that cyber incident response plan, go through your DR planning line by line, because when the worst day happens, you need to know that the processes that you have in place are going to work. And actually, I've been lucky enough to see some of the Talos engagements in action where they have stress tested cyber plans and they've simulated an exercise, and they've instigated a simulated attack. And the first thing on the document is we have to contact the CEO. Brilliant. But all of your contact information is on SharePoint and you have no internet. How do you access it? That plan doesn't even get past stage 1. So it's things like that to make sure that you have everything written down. You have hard copies. Who is on the plan? Is it just IT? Is it CEOs? Do we have clinical representation? Because this is so far reaching. So I wouldn't even be thinking, I would be thinking prior to an attack, stress test. How often are you doing pen testing? How often are you doing tabletop exercises? How often are you updating your documentation? Does everyone even know that they are on a Tiger team? Do they know what their roles and responsibilities are and who needs to communicate with whom? And who talks to the press as well, right? Let's be honest.
So those things are really important, especially when it comes to cyber, because cyber, when WannaCry happened, cyber wasn't probably top of mind in terms of our EPRR arrangements, in terms of our emergency preparedness and resilience arrangements. The playbook at an organisational level, Hannah, wasn't necessarily geared towards a cyber attack. We were pretty much writing the playbook, the response playbook as it happened. So I think, Hannah, the other thing as you were talking, I was thinking that emergency planning, the stress testing needs to be a cross-organisational, multi-professional approach, doesn't it? It can't just be the IT department testing their plans. And anybody, and again, the other thing, Hannah, the old school, anybody who's done an on-call or an exec on-call usually has in their boot a raft of folders, so having them printed out, and although that's a bit old-fashioned nowadays, it's still a really good idea to do some things, have things like that, so to get those kind of things in there. What I'd also say, Hannah, just one of the things that, in terms of the slides I was saying, if you've got a separate IT on-call structure, that's great. If you're in the senior IT department, being exposed, being involved in the operations on-call rotas is actually a very good thing as well. So you get a sense, and also that the clinical and operational people also understand your priorities, your care about. So I think anybody who's doing that now, brilliant. If you're not doing that, you should seriously consider bringing the on-call arrangements, consolidating on-call arrangements. It's still going to need a technical response, and I don't think that's going to change. But actually, certainly in terms of roles and responsibilities, if you've got senior cyber people, they should actually probably be on the general on-call roles that exist in an organisation. We're almost out of time, Hannah, and I'm going to give a little bit of time for customers, but just maybe 1, 2 things that your takeaways just before we go to questions from the audience.
So really for me, the takeaways are review the basics, do the basics well, think about those 7 different ways that you can segment your infrastructure, choose the most appropriate one to your organisation, really think about least privilege access, think about making sure that you are being as secure as you can, but without causing friction to your users. Now, what I'm not saying is it's one size fits all, because the way that a clinician or a medical kind of individual operates is going to be very different to somebody within HR or back office. So you have to apply the proportionate security controls according to those individual users, because otherwise people are going to get very unhappy, and that will lead to them circumnavigating the security controls, which are fundamentally there to protect them. So yeah, I would say do the basics, think about what is appropriate for you from a segmentation perspective, and obviously think about that least privilege access. That would be my 3 key takeaways.
In my lived experience of WannaCry and seeing how WannaCry spread across a collaborative network, my one takeaway, I would agree with all things Hannah said, but my one takeaway was pay attention to the next 2 webinars. Really start to get to grips with this macro segmentation, this ability, because when it really, really hits the fan, you're going to be so thankful that you created a network architecture that limits the blast radius of any infection, that allows you to sustain and manage. If you remember when I opened the question, I said about WannaCry, the devices that were infected probably didn't cause as much trouble as what we did in terms of managing. The micro-segmentation that happened in WannaCry was people unplugging stuff, unplugging switches, unplugging network connections. That doesn't need to happen in this day and age. So that's my one takeaway. And at that point now, I'm just going to hand over to James and say, is there any questions out there for this, for our range of experts on the panel? Hopefully I'm going to be able to divert all of those, or you are, James, to everybody else on the call.
But actually, there is one question, and unfortunately, I think it will go back to you, Declan.
Right, great.
Sorry, but just before you do that, you mentioned the next couple of sessions, and yeah, I mean, we're going to keep it simple in terms of, I think something that we talked about networking and security folks in an organization, and something that's everybody's responsible, but also something that everybody can agree on and start to think about the small steps towards creating a policy between the 2 organizations, if that is 2 separate groups of folks. And then once we kind of pick on those simple things and do those simple things well from a policy perspective, and then implement those at scale. So that is going to be how we approach it over the next couple of sessions. So very practical guidance and get started on policy. It's certainly over my time in Cisco, it's always been a great idea, but it's like the rubber hitting the road. So I'm going to spend some time on that. So the question came in. I'll move on to that now. We talked about training and it was about, rather than just sort of sitting in front of mandatory training, as it were, just in terms of what are we seeing amongst customers in the NHS around sort of making everyone aware, not throughout technology, but also the clinicians and so on. What are we seeing in the NHS in terms of getting that awareness out there? Is it just in mandatory training, or are there other? Do you have thoughts on how that can be improved upon, or things that the NHS is doing now?
So again, not being out of the NHS for a few years now, things may have changed slightly, and I apologise if they have. But so mandatory training absolutely needs to continue, and people need to be given time to do mandatory training. So people are not doing it in the evenings or on the weekends and things like that. It needs to be prioritised. I think it's incumbent upon all of us, the audience out there, the specialists, to try and bring some of that mandatory training to life. Don't just recycle the same information every year or every 2 years, depending on what your schedule is. Try and bring that to life, trying to make it interactive. Actually, if you're talking to your wider workforce, them being cyber aware, not just in a work environment, but for their home environment, can be extremely valuable to them. So you're giving them cyber skills for life. By that I mean not just for their whole life, I mean for their life, the time out of work. So let's bring it to life. Let's make it relevant to them, make it relevant to their families. So when you look at a healthcare system, you've got the employees that work for you, but generally their family and friends. When you start to consider that, you're actually touching a large proportion of the community. So let's bring it to life and train people for life in terms of cyber skills. I think there has been stuff, and I was involved in board development for cyber. I'd continue that. I'd accelerate that. And again, I would make it about cyber skills for life and really bring home to those board and senior leadership in fact, I'd almost argue that when we do senior leadership development, we're talking about managing risk in its broadest sense, which includes cyber. But again, bring it to life by making it cyber skills for life for people in their day-to-day business, because it affects us all. We can all be subject, and probably have been subject, to some form of cyber threat, whether that be social engineering to get your password. And phishing attempts. Anybody who's got a public email will be exposed to phishing attempts on almost a daily basis, James. So let's make it real and continue to develop those senior leaders, emphasising that it's more than just the cyber specialist's responsibility.
So good, thank you, Declan. So good question. Another question coming from Alex. I'll read it out, and I think I'll give my initial response, and then colleagues on the call can feel free to jump in. And so, how do you approach security in regards to costs, with more and more budgets being squeezed to save money and justify the need to spend on security, or even working with the existing tools already and readily available? Certainly, what I have seen from NHS colleagues, from CDIOs and CTOs, is taking a look at all the tools that have been purchased over a number of years at time when money's become available. And as I understand it, the NHS has a plethora of tools, and there might be a lot of overlap there, and some at different levels of maturity and being utilised. I speak to one CDIO I know that they were looking at really sort of rationalising those tools from a cost point of view, but also in terms of focusing in, and actually, rather than doing everything medium or everything badly, let's do a handful of things well. And to that point, the example, it just so happens that we focused on was Identity Services Engine. I actually said, have you looked at all the capabilities that can be there? It just so happens that in the next couple of weeks we will be covering Identity Services Engine and how that helps us with segmentation. But it was actually, I've got one software that is kind of like a Swiss Army knife here, and there is kind of an opportunity to rationalise a bit. And actually, it's upon us in Cisco to maybe do the education and training there, and saying there's more to get from that.
James, I would add to Alex, start off with a policy-based approach rather than a product-based approach, and this, look at it in terms of, well, how do we have that consistent policy around security, zero trust across all of our architecture, and make that the case by raising awareness at board level. Any board that's got a clinical capital requirement and a cybersecurity capital requirement are always going to be very much, laboured by making a choice, and they're probably going to go for the clinical one 9 times out of 10. However, if we start to describe cybersecurity as around protecting people and protecting critical clinical data, those cases, I'm not saying that you shouldn't be investing in clinical. What I'm saying is cyber is equally important in terms of protecting patients, protecting the staff. James, we're almost out of time. I just wanted to, I don't know if you're doing this or Lara, just remind our audience about the next 2 sessions.
Fantastic. Yeah, thanks, Declan. So thanks very much, everyone, for talking through and everyone for joining us. As has been mentioned throughout, this is the first of 3 sessions. So hopefully some of those key themes and priorities have resonated with what you're seeing across your organisations. But next up, we're really going to be sort of jumping into the meat there of how to approach and implement policy-based network security. And I guess coming back to the question that Alex had, a lot of what we're talking around is that optimizing and maximizing existing investments that you already have. That's really the focus here. There's lots of Cisco technologies we could talk around, but the focus is how can we start with policy, start with the network, start with maximizing what you have in place and build from there. So yeah, the next session will be 15th of May, same time, and then our final session will be taking that one step further around how you automate and implement policy at scale. So please use the QR code there, the links in the chat, the same landing page that you used to join that first session. So you can also find your original invite email. Feel free to share the session with any of your colleagues across your organisation, and we look forward to seeing you there. You got a final comment there, Declan?
Yeah, just to say thank you to the audience for listening. Thank you for taking the time to focus attention on security, and hopefully you'll enjoy the following 2 sessions. Thank you.
Brilliant. Thank you very much. Take care.